All right, this time Mrs. Ruth is going to come up to talk a little bit about compensation and the impact of the health insurance premium.
And this will give some clarity as it relates to a 2% overall salary increase versus a 3.2% increase in the rate in terms of insurance premium. So to give some context, because sometimes people hear 2% salary increase and they forget that it's 2% to your base salary and 3.2% in terms of a rate increase to your premium, which is quite a bit less than your base salary. So some clarification there so that individuals and the viewing audience can certainly have some context for when we say 2% versus 3.2%. Thank you, Ms. Ruth.
Yes, sir. Thank you. And that is a lot of what I had to share with you. But what we wanted to do is provide some visual examples of what a 2% increase looks like to base compensation. And this is purely base compensation. It doesn't include if anybody has supplements or they work additional days. This is strictly their base compensation and what the premium increase will look like for their insurance. So I'll just walk you through Teacher A. Teacher A is currently on step 1. They'll be on step 2 next year. The vast majority of our teachers are currently on steps 0, 1, and 2. So that's why I selected someone going from step 1 to step 2. Their 2% increase on their annual base pay will be $876. We have a lot of plan options for health insurance. The vast majority of our step 0, 1, and 2 employees have the employee choice plan. So that's the plan that I chose as an example. They're currently paying $13.80 per pay period. Next year, there is a 45-cent per pay period increase to their insurance rate, so they will be paying $14.25 for a total increase over the year of $9 to their health insurance premium. Okay. And you can see I have given you examples for our other 2 plans as well. We do have our signature plan, which is our most expensive option. So if I'm a teacher in the middle of the scale and I've got family insurance, I'm going to be looking at a $271.80 per year increase to my insurance premiums. You know, certainly it is significantly larger than the employee only, but it's significantly more expensive to insure, you know, a spouse and children. But it is still, you know, significantly lower than the amount that they will receive in their increase. Do you all have it? And then the last example that I have is a secretary position. And this is an example of someone on the consumer-driven health plan. And again, they will see a $12.80 per year increase to their health insurance. So while it may 3.2% may sound like a lot more than a 2% increase, it's really not when you look at the dollar value that we're starting with. Any questions?
Ms. Henry.
I just want to thank you and all the folks who work with the things we've done to try and keep healthcare costs down for our employees. The wellness center, the pharmacy, all those are extra benefits that aren't even reflected in this, but they are reflected in this in that they help us keep a lower rate. And we've all lived through years when the cost of insurance went up 14, 15%, and it did totally eat up a raise. So it's nice to have it explained that it sounds like it's going up 3%, but that's not 3% of my salary, that's 3% of my premium, and that's, you know, to have $9 difference is wonderful for the year. I mean, not $9 a month, $9 for the year increase in health insurance is pretty spectacular. So thank you for all the effort that has gone into helping keep that rate lower. And teachers need to take advantage of those other things that will help them out, like the wellness center and the pharmacy, that will lower their family health costs a great deal, in addition to the premiums being kept low.
Yes, thank you.